How to recognize early dementia symptoms and get help. Imagine noticing small changes in yourself or someone you care about that seem to creep in gradually. Recognizing these early signs of dementia can make a big difference in getting help early. Early dementia often shows up as subtle shifts in memory, thinking, communication, and behavior that slowly impact daily life. Being aware of these signs helps you seek medical advice sooner, which can lead to better management and support. One of the most common early signs is memory problems. For example, someone might forget recent conversations or repeatedly lose things like keys, glasses, or wallets. Usually, short-term memory is affected first, while long-term memories might stay clear for a while. If you or a loved one are noticing these lapses, it's worth paying attention. Difficulty concentrating and slower thinking are also early clues. Tasks that once felt easy, like following a conversation, planning a trip, or solving simple problems, may become more challenging. You might find yourself zoning out or needing more time to process information. Language issues can appear early too. Struggling to find the right words, pausing mid-sentence, or having trouble understanding what others say are common signs. These language changes can be confusing and frustrating for both the person experiencing them and their family. Getting lost in familiar places is another warning sign. Spatial awareness can decline, making it hard to recognize landmarks or navigate familiar routes. This disorientation can be frightening and is often overlooked initially. Changes in mood and behavior are also important. You might notice increased anxiety, feelings of sadness, withdrawal from social activities, or personality shifts like irritability or a lack of empathy. These emotional changes can be subtle but impactful. A decline in the ability to perform everyday tasks is a key indicator. Managing finances, cooking meals, or shopping may become difficult. Tasks that once were routine might seem overwhelming or confusing. It's important to remember that symptoms vary depending on the type of dementia and the individual. For example, memory loss is more prominent in Alzheimer's disease, while language or behavior issues may be more noticeable in frontotemporal dementia. If you or someone you know exhibits several of these signs, consulting a healthcare professional is essential. A thorough assessment can confirm whether these symptoms are due to dementia or other treatable conditions. Early diagnosis allows for better planning, potential treatments that may slow progression, and access to support services. Getting help involves visiting a doctor or a specialized memory clinic for cognitive testing and medical evaluation. Sharing observations with family members or caregivers can provide a fuller picture of changes. Support organizations dedicated to dementia can offer valuable information, counseling, and practical assistance. Lifestyle adjustments and therapies recommended by healthcare providers can also help maintain quality of life. Remember, some cognitive issues can be caused by other health conditions that are reversible or manageable if caught early. Recognizing early signs and seeking prompt medical advice is the best step you can take. Keep an eye out for persistent difficulties with memory, thinking, communication, orientation, mood, and daily tasks. Acting early can make a meaningful difference in managing the condition and supporting loved ones through this journey.